At the very beginning, let's carefully analyze today's powerful and urgent title. Senior hearts need this daily. One food protects you after age 60. The main health problem we are addressing is age-related heart disease, including arterial stiffening, reduced blood flow, high blood pressure, inflammation, and the rising risk of heart attack and stroke after age 60. Heart disease remains the #1 cause of death in seniors worldwide, and what makes it especially dangerous is that it often progresses silently for years before a sudden, life-changing event occurs. The main promised solution is one specific daily food that directly protects the heart at the vascular and cellular level, something most seniors are not consistently told to prioritize. This solution is critical because medications often manage symptoms like blood pressure or cholesterol numbers, but they do not repair arterial damage, reduce chronic inflammation, or restore endothelial function. For seniors, addressing this gap can mean the difference between independence and disability, between living at home and repeated hospital visits. Now, let me speak to you plainly because this concerns your life. After age 60, the risk of heart attack more than doubles, and after age 70, the risk of sudden cardiac events rises by over 200%, according to large cardiovascular studies. Nearly 1 in 2 adults over 65 has some form of cardiovascular disease, whether diagnosed or not. The most alarming fact is this: many seniors who suffer a first heart attack had acceptable cholesterol levels and no warning symptoms. Aging arteries gradually harden, narrow, and lose their ability to respond to changes in blood flow. If this process is ignored, it can lead to chest pain, shortness of breath, stroke, heart failure, or sudden death. Ignore this issue, and you risk losing not just years of life, but quality of life, your energy, your mobility, and your independence. But address it now, and you can dramatically reduce these risks, even after age 60. To establish trust, let's turn to medical authority. Much of what we know about heart protection in older adults comes from cardiologists and preventive medicine researchers with decades of experience. One such board-certified cardiologist and clinical researcher spent over 35 years treating heart patients, following more than 15,000 adults aged 55 to 85. His clinical observations, combined with large population studies, showed that seniors who consistently supported arterial health through targeted nutrition reduced heart-related hospitalizations by 40 to 60%. These improvements were not driven by new drugs, but by daily habits that protected blood vessels, reduced inflammation, and stabilized heart rhythm. This is not alternative medicine. It is evidence-based preventive cardiology practiced in real clinics with real patients. To understand why one food can make such a difference, we need to look at what aging does to the heart and blood vessels. As we age, the inner lining of our arteries, the endothelium, becomes damaged by oxidative stress and chronic inflammation. This reduces nitric oxide production, a molecule essential for keeping blood vessels flexible and open. At the same time, calcium deposits stiffen artery walls, plaque accumulates more easily, and blood pressure rises even when resting. The heart must pump harder to move blood through narrower, less flexible vessels, which slowly weakens the heart muscle itself. This is why many seniors feel fatigue, cold hands and feet, dizziness, or shortness of breath long before a diagnosis is made. Understanding this process helps us see why protecting the arteries daily is one of the most powerful actions a senior can take. Before revealing the solution, we must clear up a few dangerous misconceptions. The first mistake is believing that heart disease is inevitable with age. Scientifically, this is false. Studies comparing different populations show that heart disease rates vary dramatically depending on diet and lifestyle, even in people over 70. In some regions, seniors have 50% lower heart attack rates simply because of daily dietary patterns. One patient example is a 72-year-old man who believed heart decline was unavoidable and ignored early warning signs, only to suffer a preventable cardiac event. The second mistake is relying solely on medication. While medications are often necessary, they do not reverse arterial stiffness or reduce oxidative damage on their own. Research shows that medication without dietary support leaves much of the underlying vascular damage untouched. A third mistake is avoiding healthy fats out of fear. Eliminating fats can actually worsen inflammation and impair blood vessel repair, increasing cardiac risk over time. Now we arrive at the core promise of this video, the one food senior hearts need daily, and that food is extra virgin olive oil. Extra virgin olive oil is one of the most thoroughly studied heart protective foods in medical science. It's rich in polyphenols, powerful compounds that reduce inflammation, protect the endothelium, and prevent LDL cholesterol from oxidizing and damaging artery walls. Large clinical trials involving adults aged 60 to 80 showed that daily consumption of extra virgin olive oil reduced heart attacks and strokes by up to 30%, even in high-risk seniors. It improves blood vessel flexibility, lowers harmful inflammation markers, supports healthy blood pressure, and improves overall cardiac efficiency. The daily action plan is simple: 1 to 2 tablespoons of high-quality extra virgin olive oil daily, preferably consumed raw over vegetables, with meals, or taken by spoon if tolerated. Consistency matters more than quantity, and benefits accumulate over weeks and months, not years. Before we continue, please take a moment to support this channel. If you are over 60 or care about senior heart health, like this video, subscribe to the channel, and comment with your age or your biggest heart concern. This channel exists to protect senior hearts, prevent avoidable disease, and give you information that helps you live longer and stronger. As we close, remember this: heart health after 60 is not about fear, it is about empowerment. Protecting your heart means preserving your independence, maintaining your energy, avoiding hospital stays, and reducing medical costs that steal peace of mind. A daily habit as simple as the right food can support your heart every hour of the day, quietly and effectively. You are not too old to protect your heart. You are not powerless. Start today. Take control of your cardiac health and subscribe to this channel so you don't miss the next life-saving message designed specifically for you and your future.